Monistat 1 kit is used to treat vaginal yeast infections. It helps reduce vaginal burning, itching, and discharge caused by this condition. This medication works by stopping the growth of yeast that causes the infection. The vaginal product comes in two forms, a cream or tablet, and some products also include a skin cream to be applied to the area around the outside of the vagina. It's important to ask your doctor before using this medication for self-treatment if this is your first vaginal infection. Monistat 1 kit only works for vaginal fungal infections, so if you have different symptoms, you may need a different medication. If you experience fever, chills, flu-like symptoms, stomach/abdominal pain, or a bad-smelling vaginal discharge, do not use this medication and contact your doctor right away, as these may be signs of a more serious infection. If you are using Monistat 1 kit to self-treat, make sure to read all the directions on the package before using it. If you have any questions, consult with your pharmacist or doctor. This product is for vaginal use only, so remember to wash your hands before and after using the medication and avoid getting it in your eyes. The dosage of Monistat 1 kit will depend on your medical condition and how you respond to the treatment. Typically, it is used once daily at bedtime for 1 to 7 nights, as directed by your doctor. If using the vaginal cream, you will need to follow the package instructions on how to fill and use the applicator to insert the cream into the vagina. If using the vaginal tablet, you can use either the applicator or your finger to insert it. If you have itching or burning on the outside of the vagina, vulva, you can apply the skin cream to that area usually twice a day for no more than 7 days. Remember to continue using this medication every day for the full time prescribed, even if your symptoms go away or your menstrual period starts. Do not use tampons, douches, spermicides, or other vaginal products while using Monistat 1 kit. If your condition does not improve after 3 days or lasts more than 7 days, or if your infection returns within 2 months, make sure to tell your doctor. They may need to prescribe a different or additional medication for your condition. If you experience headache, vaginal/urethral burning/itching/pain, or lower abdominal cramps, contact your doctor or pharmacist. Remember that your doctor has determined that the benefit of using this medication outweighs the risk of side effects. Serious allergic reactions to this drug are rare, but seek medical help if you experience symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so contact your doctor or pharmacist if you notice any other effects. If you are in the US, call your doctor for medical advice about side effects, and you may report side effects to the FDA. In Canada, call your doctor for medical advice and report side effects to Health Canada. Before using Monistat 1 kit, make sure to inform your doctor or pharmacist if you are allergic to it, or to other similar antifungal medications. This product may contain inactive ingredients that can cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. If you have diabetes, immune system problems, or frequently experience vaginal yeast infections, it's important to consult your doctor or pharmacist before using this medication. Before undergoing surgery, inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. It's also important to ask your doctor about sexual intercourse while using this product, as it may weaken rubber products and lead to failure. It's recommended to avoid using these products during treatment with this medication and for 3 days after treatment is over. Consult your doctor about other forms of barrier protection or birth control during this time. If you are pregnant, do not use this medication for self-treatment. It should only be used when clearly needed, and it's important to follow your doctor's instructions on how to use the applicator to insert this medication. Discuss the risks and benefits with your doctor. If you are breastfeeding, consult your doctor before using Monistat 1 kit. It's important to be aware that Monistat 1 kit may interact with other medications, which could affect how they work or increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. One specific product that may interact with Monistat 1 kit is warfarin. Be sure to discuss any potential drug interactions with your healthcare provider. If this medication is swallowed, it can be harmful. If someone takes too much and experiences severe symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, you should contact a poison control center right away. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. It's important not to share this medication with anyone else, as it is prescribed specifically for you. To help prevent vaginal yeast infections, make sure to thoroughly dry the genital area after showering, bathing, or swimming. It's also a good idea to avoid wearing tight jeans, nylon underwear, pantyhose, a wet bathing suit, or damp/sweaty exercise clothes for long periods of time. Instead, opt for cotton underwear and make sure to change it daily. If your sexual partner experiences any symptoms, it's important that they contact their doctor right away. If you forget to take a dose, take it as soon as you remember. If it's close to your next dose, just wait and take the next dose at your regular time. Don't take double the dose to make up for the missed one. Remember to store your Monistat 1 kit at room temperature and keep it out of reach of children and pets. It's important not to flush the medication down the toilet or pour it into a drain unless specifically instructed. When the product is expired or no longer needed, be sure to dispose of it properly. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.